Hello.
Hello. Hello. Hello.
Come on, Amanda.
Good afternoon.
Hi.
I'm Amanda Everett. I'm your emergency management coordinator for Medical Center. I just wanted to bring a couple of updates on our emergency operations plan to you guys. Every year, this is a living, working document. So there are many revisions throughout the year, and then we get them approved through the emergency management committee, E-team, and then eventually the board. One after the next. Okay, so these are all of the components of the emergency operations plan. You can see how it's broke down into general information, emergency communications, managing resources and assets. Because of the active shooter that happened on August 31st, there were 3 changes. The first one was in managing resources and assets. We outlined that all extra resources that are deployed to different departments during a disaster will then be picked back up after the disaster is deemed cleared, so that we're not wasteful and we're making sure that we get that stuff back into normal operations. The second is under management, safety and security. We did install a safety access control button in our PDX department. It's a one-stop button for all of our DSX exterior doors to be shut at once. We do still have a couple of key locks that we have to go around and manually lock, but this is going to cut down on the amount of time that it takes to get our campus secured quickly. And the last update is under management of staff roles and responsibilities. and it was just making sure that we outlined the identification of caregivers to include volunteer practitioners and what they would need in order to become disaster credentialed here, as well as the process. And those were the only 3 updates for the emergency operations plan. And these are our top threats to medical centers that came out of our hazardous vulnerability analysis. You can see that infectious disease was part of our top 5. So there will be lots of updates and revisions that are made to our emergency operations plan, as well as our infectious disease plan after we get through the awesomeness of COVID.
Up on landslides.
What about earthquakes?
There'll definitely be a conversation next year. Whenever we do the HVA at the first quarter of every year. So whenever that was going on, we were having the massive ice storm this year. So we really figured out that that's one of our big gaps, and we really need to work on not only educating our staff, but developing the plans in order to make everybody safe, getting people to and from work, and then what we can do here on campus to keep us safer, like making sure that we have more ice melts in certain places and that kind of thing. So if you guys don't have any other questions for me?
Anybody have any questions for her?
Just need approval.
Yes, sir.
Make a motion for approval.
Second.
I have a motion and a second for approval. All in favor say aye.
Aye.
Opposed, same. Motion carried. You want me to stop and take a roll right quick?
Sure, why not?
Just because? Okay.
Thank you.
Yeah, we're going to.
Thank you, ma'am.
Thank you, ma'am. I appreciate it. We're going to stop and take a roll right quick, just so that we'll have it on record. Wallace Dunn,
Here.
David Dunn,
Here.
Richard Herrera,
Here.
Brent Dodd,
Here.
Don Hallmark, here, Mary Lou,
Here.
and we're missing Ben, so we'll wait on him. So all but Ben. Okay.
Mr. Chairman,
Yes, sir.
one thing before we move on. Amanda, you don't have to get up. I just want to tell this board, anybody that works with Amanda knows that she has been busting it since this COVID has happened. And I just want to tell you for myself and from this board, thank you for everything you've done in this COVID situation we've been in. And you've done some really good work and represented us well, especially with the JRAC. We appreciate you and your efforts, so thank you for that.
Thank you.
There's so many things that are invisible to us until we get to see you guys, and we appreciate it. I can't tell you how, it's just completely amazing the way that we've handled the things that we've had to deal with to us. So we appreciate it very much. Next, we have the consent agenda. Everybody gone over that and looked it over? Entertain a motion?
Motion for approval.
Second.
Have a motion and a second. All in favor say aye.
Aye.
Opposed, same. Motion carries. Committee reports, Ms. Dodd.
The Finance Committee met today at 5 o'clock and approved the quarterly investment report, quarter 3, the quarterly investment officer certification, the financial report for month ended June 30th, and then we approved a consent agenda with several different agreements that were renewal agreements. And we also approved 2 capital expenditure requests that are listed on the agenda. And I would move to approve the Finance Committee report.
Second.
Have a motion and a second to approve finance report. All in favor say aye.
Aye.
Opposed, the same. Motion carries. This is a lot easier than having to do roll call every time. I like seeing you guys. Okay, Mr. CEO, how are you doing?
I'm doing great. I have a few things to cover here. First and foremost, we want to thank God for Mr. Hallmark's recovery.
That's right.
Praise God. I told him if he wanted to take a tour of the place, there's an easier way to get there.
I think you want to test the nurses
Yeah.
and the staff, you know.
Man, that was a remarkable thing.
The secret shopper program.
Gee.
Undercover boss.
You can ask me out, I've already been here a couple of times.
But
Great stuff.
we're happy that we're blessed that you
Thank you.
had such a great recovery, and we're thankful that you're here with us today. We got a few things to cover here. Let's talk about, let's move to B first, the bond refunding. Steve, do you want to talk about bond refunding, or do you want to talk about that in executive session and come back? What do you want to do?
Let's do that on the comeback.
Okay. On the budget, the 2020 and 2021 budget, so we're getting ready to move into the 2021 budget. We have worksheets out to all our staff. This COVID situation we've been in has kind of thrown us for a loop this year because we had planned to get everybody back together to kind of do an all-day or a couple of day workshop to walk through these programs. And of course, as you know, as everything else in our life, that has been derailed. I would like to have, and I want to talk to y'all tonight about maybe having a planning session with the board sometime between now and the next board meeting. So when you go in here in the next board meeting, it's not the first time you see this budget that we're working on. So what we'll do is I'll send out a few dates and see if y'all can line up with that. And so we'll post an agenda, make it a full-blown meeting once Steve and all of us kind of crunch through this, but just to make sure y'all see it before we roll it out to you the first time. I will tell you that we've had some very deep conversations about budgeting. We've had deep conversations with Texas Tech, with ProCare, with everybody just trying to get to a good number that we can handle. I think on here we have the certified values. We're going to talk about those in just a minute. You'll know, and it's no secret, declining oil prices and the world shutting down puts stress on the sales tax that we're going to have a major challenge next year, and that we're going to have to kind of reinvent the way we do things just to make sure that we keep doing things. But so far, all our department heads and everything we've requested from our folks, they have responded heroically again to get us moving down that direction. But as we move into this budget and as we move into our next year, we are going to have to continue to slim things up to become more efficient and to make some difficult decisions just to make sure that we stay within our budget and that we put a good budget out there to our taxpayer. I mean, it's no surprise, right? We're all facing that on every level, professional level, personal level. We're all facing it, and this hospital is no exception. But at the same time, I guess the point of this is that what we've asked of our crew, they're doing it, and we'll have a budget ready for you. What you start thinking about tonight when you leave, start looking at your calendars between now and, the next board meeting is pretty early in September. It's the Tuesday after Labor Day. Before Labor Day, the Tuesday before Labor Day. So between now and then, all this is going to come together. And so start looking at your calendars. We'll start sending out some dates and see if we can't get some times together to get us all together. And it'll be a very condensed version of what we usually do. But at the same time, I think that it's just good medicine for y'all to see it before we roll it out and start asking you to start approving situations. I've had some conversations with a few of y'all, but just so you know, with your oil, your values declining and your tax receipts not being able to pick that up, it's probably the first time that this hospital has faced both a drastic decline in property values and sales tax. There's usually one of those is usually covering the other. And so the conversation of, sales tax will always bail out the ad valorem tax. The ad valorem tax will bail out the sales tax. Of course, things that never happened have only happened this year. And this is another one that they're both in a decline. And it's good. We're going to have to make some decisions and do some creative budgeting to make sure that we get that covered. But we'll have that ready. We will be your tax cap is 15 cents is what our cap is. We will be right there. And so here's something that's very interesting. Usually, you have your effective rate, whatever your effective rate is. Then you have your rollback rate on that, which is 8% more than the effective rate. When you move that rate in there, you're prompted to have public hearings on your tax rate. This will be the first time that you will see we will be under the effective rate we'll have to raise the tax but we'll be so far into the effective rate. Legally, we will not have to have any public hearings because the effective rate is gonna be around 25 cents. Well, we're capped at 15 cents. So we're gonna be so far underneath that we're not gonna have to have any public hearings because we're gonna be under the effective rate. Now, that's not good news. That's horrible news. The other horrible news is we're gonna be right at the cap. We're gonna be right there. But still, if we were a regular entity that didn't have a cap, we would be setting our tax rate at 25 cents is what the effective rate is, from 11 to 25. That's how much the values have declined. We can only go from 11 to 15.
Wow.
So that leaves about a $10 million deficit right there. So get ready for that. We're working on that too. So, so that'll save some meetings, but at the same time, when Steve and I are crunching numbers in a room, we couldn't get our minds wrapped around it that, what do you mean we're at 25? We can only be at 15. And so there's going to be a lot of that discussion too, but we'll have all that broken down. But just know the effective rate would have moved from 11 to 25 this year is what it looks like. And we're going to be capped at 15. So even though we're moving up, we're still about 10 cents under effective rate. So just a heads up on that.
We need to make sure the public knows what the effective rate is.
We will have that out there.
But we don't have to do hearings, we still have to post notice.
Oh, yeah, I know you got those notes.
So it'll be prominently in the Odessa.
Well, we need to have that conversation though, openly have that conversation. I mean, and at some point, let them know what other hospitals are doing. I mean, most hospitals are doing much more than 25.
And we just saw Midland go through this for pretty much the same type reason. But yeah, Don makes a good point that.
I mean, it does spur other conversations about future, what you do in the future, what that looks like. But legislatively, we are capped at 15 cents. I mean, so to change that would
Houston
change.
75 cents, I think.
What's that?
I think Houston, you know,
Yeah, most hospital districts are 75 cents. That's right.
75 cents.
So our neighbors in Midland are capped at 75 cents and they get a
Those
40-cent sales
County,
tax on top of
Allen
that.
County.
So,
We can bring that up. I mean, I think especially that now that not now, but, you know, we take care of the county still. You know, I think they need to start putting something into it. And I think it's very important that the public knows what other, you know, it's funny, whenever we go out to hire, we look at all the hospitals and what they are paying. I think, you know, this is more important than that, you know, because it affects whether we're gonna be able to stay open if we do have a crisis, or, you know, everybody has to suffer a little bit, and I believe shutting down the hospital because we're not set up to take something on like that. This is correct.
it is a threat there. And one thing we're gonna have to work with is the fact that we can't even raise it to the minimum of what the effective rate is. The minimum would have been 25. We can't even get close to that. So we'll have all those prepared. We'll have all that discussion prepared, but just a heads up to y'all that that's what it would look like if we weren't capped at 15 cents.
What is the date we have to have the budget prepared on?
September 30th.
Yeah, the 30th of September.
So the meeting you're wanting, I would say as soon as possible.
I would say it's in August.
Very late August,
Yeah.
just given that COVID's cost us time, but we're also going deeper into all the departments and digging in very deep to scrunch it. All the departments have now finished a purchase service review. We've gone every contract over $10,000. They've had to go through review, validate that it's still a valid contract, validate that they tried to negotiate it down. I mean, so as we said, it's a push to get that. Now we're starting the labor component. And those are the two big expense items that just require a lot of legwork to get to a more efficient budget.
What we have to deal with this year is one thing. The conversation of keeping that from happening in the future is a whole nother situation. So you're right. that conversation beyond that is one item, but to get our budget set and ready for this year is a whole nother item.
Right.
So the meeting I'm wanting to have is going to be between now and the end of this month, and give us some time to make any adjustments we come up with in that meeting to be able to roll that budget out in the September board meeting. We can get it posted so we can approve it, and have that set, because October 1st starts our new calendar, our new fiscal year.
Right.
So, and suddenly that's not far away anymore. So, any questions about that? Let's talk a little
Hey
bit.
guys. No.
Hey,
Hi. Sorry. Hey guys, what's up?
it's in the heating system.
Oh no, I was just sorry. I couldn't get this iPad thing to work. I couldn't find the link. I'm sorry, but I'm with y'all. I'm with y'all now. Hey Russell, I had a question real quick. What are other hospitals in Texas doing? Have we reached out and looked for some advice on how other hospitals are managing the crisis?
Yes, sir. Most other facilities have flexibility in their ad valorem tax adjustment. And so there's only 3 hospital districts that I'm aware of in the state of Texas that are capped under 25 cents, and we are one of those at 15 cents. And so they have more ability to adjust the ad valorem rate up to the effective rate than what our current capacity is. So every hospital around us that touches us, that's a hospital district, will enjoy an effective rate increase to offset the mineral decrease. Plus, they have the ability to move 8% on top of that by law without having to have a rollback election. So they'll have the increase to the rollback rate plus the 8% on top of that to be able to offset any deficit due to ad valorem tax value deduction. Does that make sense?
Yes, sir, it does. Thank you for that.
You're welcome.
Russell, do you know if this is the rate that was set 30 years ago when the charter was written?
It is.
Yeah, so-
And the problem
There's
with
room to move, right?
the problem with the rate is it is legislatively approved. So to get that rate changed would take legislative action. The next time the legislation meets is next year. So that would be something if we wanted to enter that discussion. We have some time in that, but again, the time crunch with that is there's nothing we can do between now and then to get that handled. So, but yes, I've had some conversations with several retirees. One who was on this board when this was set, and my question was, the 15 cents, where did that come from? Was it a bargaining chip or, and the answer was yes, so the county, most counties enjoy 75 cents. Ector County only enjoys 60 cents. We got 15 of that to make the 75. When this hospital district was created, that's how that was broken out, the 15 cents. And that was the reassurance to the taxpayer that this hospital district would never go over 15 cents, which was quickly followed by the sales tax election, which was approved after that as well. So most counties are at 75, most hospital districts 75, school districts, they're a little different because they get some relief on some debt and bond issues. They can go up to $1.15, I think, but most other entities are set at 75 cents per law. Per law. Yes, sir. Any other questions on that? Okay, on the value, the property tax value, we have seen the prelim on that. Last year, we were at $16.7 billion is where we were last year. This year, it came in at $16.04 billion. So it's down about $700 million, which is pretty, I mean, in the world of billions, when you're talking billions, that's pretty flat. It's about a 3%, 4% decrease.
All minerals.
All minerals. And in that, there's about 250 million additional that's still currently in protest. And we've had conversations with the appraiser's office. It seems like we can probably expect 90% of that to remain and probably 10% of that to be adjusted. So now you're talking another $20 million in there. And that's this year. And I think the real concern is going to be next year, because these values were set back in February when oil was still, $55, $65 a barrel. Now, when they roll them out this year, it's going to be set at $30 or $40 a barrel. So there's another major adjustment coming in there as well. So you can imagine if our effective rate right now would be 25 cents, when it adjusts next year, that probably would have jumped up into the 30 to 40 cent range, and we'll be locked in at 15.
There's only about 35 or 40 cases, some of them get in that protest in court.
Yeah,
I mean, and some of it goes back 10 years.
yeah, some of them do.
'Cause I see that every quarter when I go to the planning district meeting. In fact, I'll be there one tomorrow.
Yeah.
And it's, finally, there's some of them, finally, they will put accept the evaluation.
Well,
The president.
one good thing is, over my career, I've had a lot of dealings with this tax rate issue. I've been to a lot of trainings on this. I'm with Steve. I think we're pretty well versed in how that is going to be calculated, how that's going to work. We have one issue this year. Going forward, it's going to be more something else we're going to have to consider if we want to take some action to try to get that, to get us some relief there. Because again, just like everything else this year, the day that would never come is upon us, where they both have declined so rapidly at the same time. One's not there to bail out the other, and that's going to make us perform better, is what it's going to do. So, the sales tax, being as high as $56-60 million, for that to drop to $40 million, if not lower than that, I mean, that's a huge blow to us. It's a big deal. The good news I heard in the state of Texas in the month of July, that the sales tax was up about 5%, so that'll move it up a little bit. So,
Home run?
but we'll see what happens. Nobody ever thought the government would shut the world. Well, the world was shut down in April or May? When was that? For 30 days. I mean, so our sales tax, we had next to nothing for 30 days. So, and that just plays into the long term. So we'll deal with it. It's nothing that's not overcomable, but it will make us more efficient in what we do.
I would like to say something, just watching what you have done, and Mr. Ewing, I really want to commend you guys for being so proactive, and the executive team. I know that you guys are making some really tough decisions that have to be made. And I just really want to commend both of you guys for doing that.
Thank you.
And I'll tell you that I think I've seen and heard things way beyond what you might even understand or know that these guys are after and they're doing. It's mind-boggling, and it's amazing what they've done for us. We won't be able to even see or talk about it for 6 months, but it'll be there.
But when we roll into our crews and we tell them, you know what, not only are we going to cut your budget, we're going to cut your pay, we're going to cut your staff, and our crew steps up to the line and says, well, let's get it on and let's take care of our patients. And then to deal with what our staff is dealing with on a day in and day out basis, these people putting their lives on the line. When you start talking about people facing this disease every day, and it makes money seem pretty simple. When you're talking about people who are putting their lives on the line every day. I mean, it makes what we do almost comical, because these people are risking their lives every day to take care of people. And those are the true heroes and the workers out there.
I was proud of what Lorraine said today about her being in Midland, on the advisory board, the hospital in Midland.
Yeah.
She's on the advisory board. And she said our hospitals are twice the hospitals they have in Midland.
Yes, sir.
And she's on the board.
Yeah, she's on the
And she's retired, a nurse with a master's degree.
Yes, sir. Okay, not that we need any more sad news, but anything else about that? Our COVID situation, I'll let the two doctors here, if they want to comment on this. We kind of feel like, we're kind of it's still rising, but more of a plateau. The 26 number we have today is a great number. You know, we usually roll in on Mondays with about 30, 35. We end up Thursday, Fridays about 50. And today is 26. We're encouraged by that. I think what you're seeing is the mask mandate that rolled out the end of June, the 1st of July, it works. I mean, it works. It slows down the exposure. Our crew has done great as far as fighting this off and protecting themselves. And the stories that I know y'all are hearing, and I'm hearing those too, about, and here's probably the best one I can tell you. I was walking out the door the other day, and it would look like a hotel checkout time out here in the front parking lot in the Circle Drive. There were so many people checking out. And the gentleman hollered, he said, Mr. Tippin, Mr. Tippin. And I was like, hey, how's it going? And he kind of waved me over. I said, how you doing? And he said, I'm doing good. He said, you don't know me. He said, but this is my wife. And this lady was sitting in a wheelchair. And he said, she's been on the ventilator for 15 days. And he said, she's going home today. And they both had tears just rolling down their face, which you know what that means. I wasn't far behind them. And he said, I want you to please tell everybody that in this hospital that they saved my wife's life and that they are saving people's lives every day in this hospital. And just the emotion that these people had just tells you, I mean, this lady, he said they had prepared her funeral. They prepared for life without her. And now here she is getting in the car and going home. But that's the kind of work and the love and the care that we're giving these people to get out of here, to get back into their lives. And that was very emotional for me. And it was very big for that dude to wave me over. And he said, I just recognized you from being on TV, and that's kind of embarrassing, you know. When I'm in a restaurant with my family and the TV's on and they're, you know, my son's like, well, there you are again, you know, on TV. But just to feel the emotion from those people, how thankful they were. We were their Dallas and their Houston. That's us. That's who we were to these people. But you guys want to say anything about our COVID situation or what you're seeing, Donnie?
I think the hospital is the best barometer, and seeing that number come down, I mean, it was a few weeks ago, we were what, in the 50s?
Mm-hmm.
And it was tremendous strain around here, right? And seeing that number come down to me is a barometer for the community. The other interesting piece of data on the health department's website from the county is the rolling 7-day new cases graph. And for the last 2 weeks, that has trended down. So to me, maybe there is a little less virus. Then you have to kind of balance that with the positivity rates that are being reported. But even that has slightly trended down, whether you look at the city testing or the total county numbers. But, so those are positive trends. But I think the hospital is the best barometer.
The positivity rates are affected by how many times we're going out doing 100 or 200 a day, and we were well at it several weeks ago, adding 200 a day every day.
Sure, yeah. But it is still a percentage or a ratio.
Sure.
I just have maybe it's an odd question, but, you know, in the oil field, there's sometimes when you get like into H2S and it damages the metal so much and then go down again and it's kind of not as bad because H2S is kind of thinned out. And to me, the patients are the H2S. You know, there's only so many of them that are going to get affected, you know, by it to a point where it's going to be just deadly and bedridden. And then I have a brother-in-law, sister-in-law who both had it in a week. I mean, they didn't even know they had it. They got tested, and one's a nurse and one's a police officer. In 5 days, they said they kind of felt sick, but they didn't really. So what I'm wondering is, are we seeing, you know, whenever we overexpose, we hit those people who are more susceptible to it because more people are carrying it, you know, or is it just something that it's a given? I don't want it to be political. I'm just at this where we're trying to figure it out. You know, people in my district call me and they ask me, what do I do? And I, my deal is stay home if you feel that you're susceptible to it. If not, put your mask on and try to live your life best possible,
Yeah, I think that's a little bit of math and probabilities is what you're saying too, right? So
Right.
the greater the prevalence of the virus, or the greater the sort of volume or body of the virus, the more likely it is then to hit the vulnerable.
Right.
And as the body of the virus comes down, then fewer vulnerable will be hit. But that's the key. We don't know who that's going to be, and so the best practice is to just be on guard.
Well, thank you. We are as confused, even 7 months into this, we're still, a lot of people call and, being on the board, they want certain answers and you don't have them, and just have my opinion and, sometimes that's not worth anything, but, it just, we don't know. I got 3 kids that are teenagers and they're just
They don't
going.
listen to you either.
No, but they've been all over the state of Texas and other states and playing sports and nothing, none of the kids that they've been with, nothing, and, some of the kids that have had it, nothing, and then I see, some in the 40s and 50s that are passing, and you say, what's happening, how many, 1 to 15-year-olds have passed away, what are we looking at and how can we, better try to open up the world where we're not penalizing those who can move, even though a 50-year-old will come home and, maybe to my mother-in-law and pass on her and kill her, but how do you try to, get some movement out of where we're at? It's difficult.
I think you hit 3 words: we don't know. And I think we don't know for a long time. Even as the medical field changes, and we've heard it all across the board, this is good treatment, this is bad treatment, then it comes back around, we should stop that treatment, we should start this treatment again. We're still pretty confused with regards to it for just the reasons that you spoke about. We don't know how to treat individuals, who's going to be affected, who's not going to be affected. And that's the struggle that we have within the hospital as well. What everybody in this room decides upon and how we structure things plays a big role in how this hospital is going to run and what this hospital is going to be like in the future. And from a medical staff standpoint, we have to start incorporating this, I think, into our ideas about how we're going to manage patients long term. Because I think we could all sit in here and understand that this isn't going to go away in November.
Mhm.
That's going to be around in a year, and we're just going to have to figure out how we're going to manage COVID along with all the other medical issues that we have. And nobody has any good answers to that yet.
Yeah, because
They'll come, but it's going to take a little bit.
my biggest fear is coming into the winter, we got the flu coming, and then we have this, and you have pneumonia. So more people are going to become more susceptible, especially the elderly, when it gets cold. And I just,
Talked about me that way.
I didn't say you were elderly. Old and elderly are 2 different things, so I don't know, what we're going to be looking at when it does get colder and you have the cold, the flu, COVID, pneumonia, bronchitis, strep, and all these other things coming together, if it's going to get worse.
Well, hopefully our social distancing and such will help on those too. So, okay.
I'm sorry, just
Go ahead.
one more thing, sorry. I just want to talk about our pressers. We've been having our Zoom calls. I know y'all get a lot of feedback on those. We get a lot of feedback on those. I will tell you this. One reason we do those is if we weren't informing the public, the question becomes who would be giving out that information? And right now, there's nobody else in this community that I'd want communicating that other than us. And we've been doing that since March 2nd. It was when our first meeting was. We do report all the deaths. We do report those out in a press release, just to try to be on the forefront of that. It's not because we're trying to promote this. We're not trying to be political with it. We just feel like it's better to inform than to be somebody, if somebody comes looking for something, that makes it a whole different situation than us reporting it. We've had our our health hospital incident management team meetings. I think we had our 85th one. What was today? 80 what? 76. It's just, it seems like 8,000. But at the same time, it is taking up a lot of our time. As it normalizes, you'll see that kind of fade down a little bit. You remember for a while, we were having those Zoom calls every day, which was a lot. And right now we're at 3 times a week, which is honestly is still a lot. But again, we are giving out the information. We know it's accurate. Just right now, I don't think that there's anybody that's given as accurate as information as we're providing.
And if you weren't given it, they'd be coming after it.
They'd be
I
coming
think that
out.
is well recognized in the community too.
Yes, sir. Thank you. Okay, on here, I do have one for y'all's consideration. Right now, Steve is the only executive on the investment account. And we are of the thought if something ever happened to him or if something we would not have anybody else on the investment account.
Can we say a little bit differently?
He's on vacation.
No, when Abernathy was here as the CEO, we missed the step when we should have had Russell put on back in September when he came on. We just missed that step. As we were going through the annual review, we realized we only had 1 investment officer. We do need 2.
That's what I meant to say. Just so you know, I do go to the public investment training. I'm all certified for that, but that does take board action to put me on as that. And I think that that's smart business to have 2 signatures on there. So I would recommend that to this board.
I make a motion that we add Mr. Tippin to the investment council.
I have a motion and a second on that, so all in favor say aye.
Aye. Aye.
Thank you. One more bit of news. Tony, y'all know Tony Land. She's been with us for about a year. She has submitted her resignation and she's going to move back home. And we are going to miss her greatly. She and I were in orientation together. And she's going to move back, and she has come across a great opportunity, not only to work from home, but to be with her grandbabies and husband, and I don't blame her for that. Right now, in the interim, Courtney Look is the interim person for that. We do have that job posted, and we'll keep it open for a while and then decide what to do with it after that. But I just want to make y'all aware of that. Tony has been great. She has moved us forward and has given us some direction. She got me to read a book, which was a huge, feather in her cap, and we're going to miss her. And if you're on the line, Tony, we love you. We're going to miss you, and thank you for what you've done with us while you're here. And unless you have any questions, that will conclude my report.
Okay. I hate to hear that about Tony, because she was a great addition. Okay, so that takes us into executive session. So meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to section 551.071 of the Texas Government Code, deliberation regarding exchange, lease, or value of real property pursuant to 551.072 of the Texas House Government Code, and deliberation and evaluation of officers and employees of Ector County Hospital District pursuant to section 551.074 of the Texas Government Code, and deliberation regarding regulations for health care services pursuant to section 551.085 of the Texas Government Code.
What time is it?
6:26.
I can't see.
6:26.
One more thing. We're going to have executive session in this room to keep us spaced out. So if you're not involved in executive session, we'll see you later. For those of y'all that are, we have food and drink in the next room. If you want to go get it, then come back in.
Okay, and Ben, I guess you'll be calling back in.
Yes, I'll call right back in.